What's the first step to getting started with full arch implants?
We have people called treatment plan coordinators, and what you can do is you can book a consult, you can do it online, or you can do it in person. We have them in most of our clinics. You can come and talk to them. They'll be able to give you all the information, and then they'll be able to see, where do you live? How can you get there? Can you come into our hospital in town? Do you need to go to one of our outlying clinics? Is there parking? We can figure it out that way. And then they will find the surgeon, they will direct you, give you the information, give you the costs, give you the options, and then you book in for a consultation and scans and x-rays with one of the surgeons. Also, our treatment plan coordinator doesn't cost us anything. That's a free consult.
It's for free.
It's definitely worth your time.
How are we improving the full arch implant option for patients?
Making it more available to people. There should be nobody who should be afraid to come in, ask the questions. There's different price schemes. Some things are included in some things are included in others. And we have tailored it to suit everybody's budget. Come and talk to us. We have different payment schemes. People get really, really upset and they're like, oh, this is the worst mouth you've ever seen in your life. I doubt it. We have seen it all. It doesn't matter. Firstly, we want to help. We want to see what it is you want to achieve, and then we'll figure it out along the way. It's important that you get what you want from it. Do you want that big, bright white smile? Do you want people to think that, oh no, I just had crowns done? That's okay. Tell people what you want. We're not going to judge. You think you might want a full arch. Oh, I have to have all my teeth out. Not necessarily. We're conservative too. We can maybe do a full arch on the top and then maybe some composite bonding on the bottom. We can mix and match. Things happen in people's lives. No one really loves coming to the dentist, but genuinely, you'll start off being anxious, nervous, whatever. By the end of it, you'll be so sick of looking at us, we'll be best friends. You're going to miss coming to see us.
How do I choose between the core, premium and advanced options for implants?
Have a look on our website, figure out the price ranges, what's included, what's not included. People will come in and they go, I only want to do the core, and then you have 24 teeth to take out, and then I'm going to unfortunately charge you for every one of those 24 teeth to take out, and then by the time we add it up, it might not really be for you. Or also, if you're 30s, 40s, and you want the perfect smile, you want stain here, you want all the little nuances in teeth to make them look natural, then not necessarily core is for you. You might need to go to advanced. We can balance it out. You do need to be a little bit open-minded. By the time you go core, you add up all the stuff that's not included. The sedation can be per arch, per hour. Then if you might need lots of bone, lots of extractions, it doesn't make sense to do it. Whereas if you go with the advanced, all those things are included. If you have all your teeth, we have to take out all your teeth.
Okay.
We're going to put in, with the core, you're going to have 4 implants on top. You're going to have 10 teeth on a bridge on those 4 implants. To future-proof you, we're going to fill all the holes where all the teeth were with a bone graft. And also, if you want to pay up front, you'll get a discount with the advanced. You don't get it with the core. Something that used to be fancy. It used to be, oh God, you'd have a money tree in the back garden to pay for this. It's not like that anymore. The more we get that message out, the better. The reason we're doing this is to make implants more achievable.
What is the core basic implant option and who is it suited for?
4 implants are included. For a single arch, it's €6,500. You still get your digital smile, you get 10 teeth, you still get your photos, all those things. The end result may not be as polished as the advanced. It may not have the stain. We don't have the full range of colours. They'll still be beautiful. They definitely will, but they may not be as aesthetic or fancy as the advanced option. If it's a double arch, it's €12,000. Sedation isn't included, bone isn't included, your night guard's not included, and your extractions aren't included. That's a big thing because that can add up. We can tailor make it to everybody. Just come and talk to us.
What makes the truly advanced option different?
It's 11.5 for a single arch and it's 19 for a double. It's pretty much everything's included. Your extractions are included. It's 4 to 6 implants. It's 12 teeth, so you'll have 6 to 6 on your bridge. There's zirconia. The final bridge will be as realistic, as natural as possible. There'll be little veins in the gum, little stains on the teeth. You can have luminous white teeth if that's what's going to suit you, or you can have darker teeth, say your own natural teeth on the opposing arch or something like that. Your bone is included, your sedation's included, and for someone who has up to 10 teeth, the extractions are included as well, and you get a night guard as well. Also with the advanced option, if you pay up front, you're entitled to a 10% discount. That's the deal breaker, the discount if people have the money and that's the way they want to pay.
What does the truly premium offer that the others don't?
6 implants. It includes zygomatics and it includes pterygoids. Imagine if they don't have a lot of bone around their areas of their premolars and their molars because of sinus, or if they've lost a lot of bone, if they've, say, been in a denture a long time, whereas they can get pterygoids or zygomatic. And sometimes, unfortunately, it might be the only option. For that, you need some of our more skilled surgeons. Not all of us will do something as complex as that. Also, the end product, they're individual Emax crowns that are cemented onto a substructure, they are going to be absolutely beautiful. I always say to people, get me a photo of your own teeth and we will do our best to match it. It is 18.5 for a single arch and then it's 28 for a double. We will get your temporary teeth to as near possible the end result. Maybe not with the colour, sometimes the colour can be a little bit white, but the shape and the size and the length and also what suits your face. Yeah. But your new ones are going to be lovely. They're going to be so smooth and shiny and polished. You come in, you've had surgery, you're sedated, you go home. Do you really want to come back that evening? Usually suits most of my patients to come back the next morning. Gives me time to get them designed digitally. Me go, yeah, I love them. Then we print them, we polish them, we paint them, we glaze them, we cure them before you're ready the next day or that evening to put them in.
Why are we changing the way we do full arch implants and how will it benefit our patients?
We want to make it more available. As we do more, we get better. Technology is advancing. We are keeping up with the time. We have lots of nerds here. Everything we do is digital. We want people to be healthy and we want people to be happy and smiling and not let dentistry be taboo. We want to just be part of their everyday healthcare.
When you said about people who might need a lot of teeth taken out, are there many cases in which if you do have nearly all your teeth left that you are a candidate for full arch implants?
It's a mix. It's a terrible thing to think of that it's not cost effective to say have to crown every single tooth because those bills add up. You might have to have load of root canals in the past. They might need to be redone, or as cases that we have quite commonly now is turkey teeth where people have come in and they've had a load of teeth done, they're missing teeth and everything is all attached together. Their gums are in a hoop. Then we'll just take them all out. I'm not saying no one's a candidate for full arches. Also, there are people who will come in and really they need ortho and a bit of composite bonding and they want to have a full arch because maybe financial reasons. That's not necessarily where we're at either. We have to be ethical about what we do. That just because a full arch might sound financially the best option, ethically and professionally, sometimes it isn't. There are cases where we have to go, you need ortho.
We do get some people in our TikTok comments, they have healthy teeth, but they see the result of full arch and they're like, I want that now.
Sorry, you're in the wrong place. It's not a one for all. It's only for you. It's not for your friend on the street. It's not for your neighbour. That treatment plan is just for you.
What are pterygoid and zygomatic implants?
This is your zygomatic arch here and your pterygoids are way back here. So they are very, very long implants that go in the back of your mouth and then they go back here and then it gives us space in your mouth for your implants to put some beautiful pearly whites on.
What is the difference between general anaesthesia and IV sedation?
General anaesthesia is something traditionally would have been done in a hospital. Someone who's a doctor and they have specialised in anaesthesia and that's all they do. Though we have a new hospital here where we are currently and we have a general anaesthetic clinic and we have just currently employed an anaesthetist. Very soon we will be starting. We have traditionally used external clinics because I've done a couple of GA cases where somebody, whether it was true to their medication or their medical history or getting veins. Most of our surgeries are done with either oral sedation or intravenous sedation. And that's where you come in, someone has to just come and collect you and we put a little cannula in and it's conscious sedation. You are awake, you can answer questions, you'll be very, very chilled. And then you just go home, have a little bit of snooze. What's good with all of these things as well is lots of people don't remember what has happened. It gives your muscles a chance to relax because your mouth's open for quite a long time. And if you're sedated, you don't get that tenseness, you're just chill and we'll just look after you all the way through the procedure. It is a very rare occasion where we can't do IV sedation. IV sedation is very, very safe. We can reverse you at any stage. General anaesthetic, it's not as accessible. It is now. It's also expensive. General anaesthetic is included on our premium package. It's not included on any of the others. And you'll probably pay 3 to 4 grand for general anaesthetic alone.
What is involved in giving a testimonial and what's in it for me?
A testimonial is you've been through this journey, especially when someone comes in, they're very anxious, they really can't cope with being to the dentist. You have to attend a few times. By the end of it, you won't care what I do to you. You'll be so used to me. You'll be so used to sitting in the chair, the environment. If you've had a good experience, if you're happy with what you have, we just want to get the message out there. And it's very easy for people to see me going, oh yeah, you're going to be fab, it's going to be easy. But to hear it from an actual real human being and to physically see them sitting there smiling, and then obviously we will give you something for coming in and your time, your yearly recall going to be covered. We do a lot of redos of turkey teeth where they've had a horrific experience and then they're having to go through the whole thing again. We want to stop people from going. Genuinely, please, please, please don't go. There's never a time or place it's going to be worth it. It's too hard to fix.
And so many people who come in and film their testimonials, they say they would have never come in to get this treatment, but they watched a testimonial.
Absolutely, especially some older people, or they'll have someone, oh my God, did you see your man? And that's why it's really important to get our message out there. And also for the public to see that we're normal human beings. We're not weirdos.